Okay, this short video about science actually. This what I want to tell you, that for science it is very important to have critical mind. And science is nothing more but opinions. And what is important for science, it is free discussions of the opinions, so that we have to find truth, what is working really, what is the real world, and then to find this truth we have to discuss some ideas and data and make experiments, etc. So just recently, it means February to this year, end of February this year, an article was published in Journal of Medicine. It is still quite respected journal, and about mechanism by which face mask contribute to the COVID-19 fatality rate. Okay, so it is really, it's actual observation study. So people made the statistics, and now we have to discuss it, because it's everything what is related to this COVID virus is not easy, absolutely not easy to understand, and this is quite very new, and people started to fight this virus and these infections with the methods which probably not the best. Maybe, again, nobody knows what will work. Nobody, even theoretically, we know that vaccine should work better, but what kind of vaccine? Vaccine, before it will be implemented, it has to be tested for years and years and years. We don't have time, so therefore there was some radical measures implemented, and then again we better think and evaluate for future, will it work or not. Okay, so in these publications what was demonstrated, that mask mandate had significantly higher rate of fatality rates. Okay, yes, okay, so it was this was statistical observation. It was not double-blind control experiments. It was statistics, but yet we can talk about some, at least correlations. And again, with all statistics, we can say that this correlation is strong, and we can rely on it. So what is going? That keeping mask, especially mask, if you don't change them, it might pose an unknown threat to the user, and instead of protecting them. So, and again, this is mask mandate is a debatable epidemiological intervention. So we don't know. Again, there was a test, and what is demonstrated that almost twice higher probability for people who are getting COVID infection to die from this COVID infection if they keep mask on. If they keep masks on, then probability to die from this infection is twice higher. Of course, we have to consider many other parameters, but we have to also, this is some preliminary, I would say, and research. And again, what is there were experiments on animals, and on animals it was proven in this experiment that mask is not helping. Mask is not helping, that it's vice versa, it is harming the animal and humans. And there is some explanation why it is happening, because if you keep a mask, you don't inhale enough oxygen. So it is, again, you have, and you are breathing out, and you actually re-inhale some droplets. And then if you got infection, for example, this infection, when you are breathing out, then you probably protect other people from your community, but droplets with these viruses, they accumulate in the mask if you're sick. And even if you don't have any symptoms, you have probably these viruses. And then droplets and these viruses accumulate in the face mask. And then it is actually make your disease, make your symptoms worse. So it is really can contribute to death, to higher death rate. Okay, there was also in other publications a year ago, exactly about longer already than a year ago, that it was considered is effectiveness of a mask that's working or not, and what was this was test. This was a honest test and very big. 3,000 participants were assigned to wear mask, and about 3,000 were assigned not to wear. There is a control, so it is quite correct experiment. And what was demonstrated that mask may reduce, but not significantly. It is 0.3%. It is absolutely not significant. That it will change a little bit rate of infections, but this rate is different. So it's in previous publication was, I mean, what was I referring here? It is about consequences like COVID-related death rate. And here it is with just infection rate, it is different. So those who are with mask or without mask, almost the same, 0.3% point difference, and high statistical correctness. So it is a conclusion that, again, this is probably we need other means of protection for sure. And one more publication in April 21st, a year ago. Again, it was a randomized, placebo-controlled trial and very honest. But again, it was not demonstrated that the effect was insignificant. It's almost insignificant. Meanwhile, mask may cause discomfort and communication difficulties. But what I should pay attention that if you compare confirmed death rate from COVID in different countries, what we see? We see here that Italy, Spain, United States, and the United Kingdom have very high rate of death from COVID, very high. But meanwhile, such countries like Nigeria, Bangladesh, Pakistan, India, very low, almost nowadays. Here it's, for example, Nigeria is not getting any death, almost nothing to the March of 2020, but in time it accumulated, but its number of deaths is almost negligible, almost nobody was dead. And if you look at typical market in Nigeria, so we see that people don't care much about hygiene. But what is good, they eat a lot of lemons, and they eat of such food that is help to fight diseases. And nobody of these people, you see, nobody of these people is obese, overweight. Nobody is overweight, yeah, Nigeria. And what is correlation again? So it looks like England was used to have the highest coronavirus outbreak and the highest rate of infections. And why? There is some idea why it is. Because in England, a high percent of population is overweight and obese. So obesity makes increase death rate, increase infection rate. So it is again, mask is just, again, it is insignificant different, but what is truly helpful to keep your body healthy. And if people overweight and obese, they suffer a lot. Here again, what is a comparison between COVID death? It is death rate per 100,000 population in different countries. And UK very high death rate, yes, and from COVID. And in India, low, because Indians are not obese people. They are not overweight people, mostly. In Vietnam, China also not much. And here, if we look at this slide, we see that number of people, even in America, is compared to Europeans have high death rate, but we can see that overweight and obesity creates larger problem than the COVID. COVID is certainly a problem in America, but main part of the death rate, excessive death rate, is overweight and obesity. So, and again, we with medical professionals try to fight this COVID virus, but they didn't care about overweight and obesity. This is wrong. This is certainly wrong. So for humans and for you, if you want to stay healthy, please mind you have to keep your body healthy. And first of all, you have to keep your body not too much overweight. Okay, and better stay in good shape. Okay, I'm not a medical professional. Of course, I cannot give any medical advice or consultations. This is just, I'm a professional physicist. And biology is just my hobby. Last year I decided that I will work research in biology because I want to improve my health. I definitely see that that COVID and other infections can be deadly, and the only way to fight these infections, in my opinion, to make my body healthy. And this is what I try, and I do it, and I think I improved my health a lot. But it's again my personal opinion, and what works for me, it may not work for other people. So I don't recommend anything, but more than just try to stay healthy. Okay, that's all for short video. Take care.